Hello, I'm Dr. Daza. I'm the clinical market lead for Sanitas in Florida, and today I'm going to talk to you about the importance of COVID vaccination, especially among healthcare workers. We are in the middle of a pandemic, and we have been enduring many things over the past year and a half or more. We've been restricted to go out in public. We've been restricted to see our family members, our dear ones, at some instances. And we've learned to do many other things like washing our hands more frequently, wearing a face mask, and social distancing. But currently, the most important public health action to end this pandemic continues to be to increase vaccination coverage, because we know that it saves lives, it prevents disease, and decreases the spread of COVID-19. Vaccines have been around for decades, and in many cases we know that they don't only prevent against getting a disease, but they may also prevent against death. What we've seen during this past year and a half with the coronavirus pandemic has been remarkable. There's over 200 different vaccines under development, and all of them must go through a rigorous process of approval, which implies clinical trials to show that they are effective against this disease. Of those, 112 are still in clinical development and 184 are in preclinical phases. But there's 13 of them that have been already approved for emergency use or fully approved in some countries for use. And 4.5 billion vaccines, 4.5 billion with a B, vaccine doses have already been administered. What we know of the coronavirus vaccines is that they are highly effective. Any vaccine, in order to be approved, must show an effectiveness, which means that they decrease the chances of getting the disease by over 50%. In average, depending on the manufacturer, we have seen effectiveness rates ranging from 70% all the way up to 95%. The world is currently seeing a spike in cases in many countries. Those cases are widely attributed to the Delta variant, a variant of this coronavirus that is highly effective at infecting other people, and that we also know that seems to be more aggressive and cause more severe disease. So a common question that we get asked almost on a daily basis is, are the current vaccines available effective against this Delta variant? The reality is that more studies are needed to really assess the effectiveness of these vaccines. However, current evidence is suggesting that most vaccines remain highly effective against this Delta variant. And what we also know is that all COVID-19 vaccines have proven to be safe, effective, and life-saving. However, we know that there is no perfect vaccine. There is no vaccine that will provide 100% protection. So there will be cases of breakthrough infections. We've seen, and we are currently seeing, breakthrough infections. This is when a person gets infected with the virus despite having been fully vaccinated. This will happen, and it is happening. However, what we know is that those cases are milder, and that most people with this will survive. Because vaccination is very effective in preventing hospitalization and death. Vaccines prevent about 90% or more of severe disease cases. But it is less effective in preventing symptomatic infection or transmission of the virus. So even if I'm vaccinated, I can get a breakthrough case and I can infect others. But the likelihood of this happening is much less. It's about 8 times less likely than if I'm not vaccinated. So what is happening with non-vaccinated people? We know that this Delta variant is at least 2 times more contagious than the previous variants. It's more effective. It will get more people infected. And the greatest risk of transmission is again those who are unvaccinated, because they're much more likely, like I said in the previous slide, to contract this disease than those that are vaccinated. Therefore, they're more likely to transmit this infection to others as well. Data suggesting that the Delta variant causes more severe disease than the previous strains, especially in those who are unvaccinated. Because what we've seen is that the viral load, the quantity of virus in the body of those persons that are not vaccinated versus those that are vaccinated is much higher, causing more disease, more severe disease, and more chances of infecting others. We've also seen, because of this, that vaccinated people seem to have a shorter period of the disease. They recover more and they recover faster. People who are not vaccinated tend to have a longer disease. We know that many cases are mild, but it tends to be longer. And those who end up with severe cases end up taking a lot more time to recover than those patients that are getting breakthrough infections who are vaccinated. Reports from King County data in Seattle, Washington are showing that a person who is not vaccinated is 7 times more likely to test positive for coronavirus, is 50 times more likely to be hospitalized, and is up to 30 times more likely to die from COVID-19 than a person who has been vaccinated. However, even if you've been vaccinated, we must continue to protect ourselves with the non-pharmacological measures. We should continue to wash our hands frequently, wear a face mask, avoid crowds, cover our cough, increase ventilation, and very importantly, stay home when you feel sick. What about healthcare workers? We know that being a healthcare worker increases our exposure to the virus and the variants. Why? Because we might be taking care of a patient with COVID-19. We might be taking care of a patient that was exposed to somebody with COVID-19, or simply by being around patients who are sick, coughing, or might have other conditions, and we don't know if they have the virus or not. So our chances are high. But we must remember that the first line of protection for healthcare workers continues to be the appropriate use of PPE, personal protective equipment, which includes the use of face masks, gloves, gowns, and eye protection. But you can increase that protection and help protect yourself and your patients by getting the COVID-19 vaccine. Because we know that vaccinations reduce the transmission of the virus. How does it reduce it? Because the chances of you getting infected is reduced, and even if you get a breakthrough infection, your viral load, like I mentioned previously, will be lower. And that lower viral load will make it less likely that you get a severe disease, and also less likely that you infect others. So by getting vaccinated, you're not only protecting yourself, you're also protecting your patients, you're protecting your friends, and you're protecting your family members. Therefore, all healthcare personnel is recommended to get vaccinated against COVID-19. Despite all the evidence that shows that the current COVID-19 vaccines are effective, especially against severe disease, hospitalization, and death, there is a large proportion of the population that remains unvaccinated. And it's normal for them to have questions about these vaccines because they want to make the right decision for themselves and for their loved ones. So how can you help? How can we promote vaccination? We must start by listening with empathy and acknowledging what they feel. Once they feel heard and respected, they will be more open to share their feelings, to share their questions, and also to listen. Ask open-ended questions. Questions like, what have you heard about the COVID-19 vaccines? Why do you feel the way you feel about the vaccines? This will elicit a conversation, a more open conversation. Close-ended questions that will only elicit a yes or no answer, like, do you want to get vaccinated? will not help with the conversation. So always ask open-ended questions. And then share trusted information. You might not know the answer, or you might be unsure of something that you're telling that other person about how to address their concern. So offer help to look for this information, and to look for this information by trusted sources. Sources like the World Health Organization, the CDC, or your local health agencies. And then there is nothing that works better than sharing your own reasons and your own experience. People want to hear how you felt when you got vaccinated. What were your reasons to get vaccinated? What were your reasons to promote vaccination for your family members or even your children? And how was your experience with the vaccine? We know that side effects are common, but they're all usually mild. And when people who have some sort of hesitancy can hear that somebody like them has gone through this process and did okay, they might be more open to getting the vaccine in the future. And then lead by example. We cannot promote vaccination among our coworkers, among our family, among our friends, and in general the public if we're not vaccinated ourselves. So let's start by getting vaccinated ourselves. A conversation will go a long way in sustaining vaccine confidence. Sharing your motivations and what helped you overcome any concerns will be very effective. Please help us promote vaccination. And remember, start by vaccinating yourselves. This is all for now. This pandemic continues to evolve on a daily basis, and that is why the clinical team at the Carroll T organization will continue to monitor the situation closely in order to be able to bring us the most accurate and up-to-date information so that we can take care of our patients, of our loved ones, our friends, and ourselves. I hope this information was useful. I hope that if you haven't received the COVID-19 vaccine yet, that you will get it soon. And those who are already vaccinated can help us promote vaccination among our coworkers, our patients, our family members, and our community in general. Thank you very much, and have a great day.